Good afternoon, William and Mary. We are in the last week of a semester unlike any other. Undergraduate and many graduate students will finish exams on Tuesday, some remotely and some on campus. Law school exams will take place after Thanksgiving. With just a handful of days left to go, the William and Mary community has accomplished so much with so much effort. We've successfully mitigated the spread of COVID-19 on our campus. We've avoided the large-scale quarantines and closures that we've seen at other institutions around the nation. We've created ways to work and live and learn together that mitigate the spread of COVID-19. These achievements took months of planning and total dedication to implement and improve as we went. Our students and our staff and our faculty deserve so much credit for creating shared norms together. And our neighbors in Williamsburg supported those norms with incredible generosity. So just think for a moment about where we were in August as we were headed into this semester. Our local region was a hotspot of COVID-19 spread in the Commonwealth. We were nearing a 10% positivity rate. And we have, over the time since then, with our localities, maintained incredibly low positivity rates. It's a credit to everyone working together. So to everyone who is tuning in to watch this afternoon, thank you for upholding our Healthy Together commitments with so much dedication and trust in each other. You've been exceptional partners in keeping our community safe and in sustaining William and Mary's mission at an incredibly difficult time. Even as our country now faces sobering public health challenges, in many ways more sobering than we saw in August, with much vulnerability and much worry, the William and Mary community can take a moment for gratitude for what we've achieved and for what we've learned together. So gratitude and lessons learned are the themes of this month and this month's community conversations. I'm going to be very brief in kicking things off to save as much time for discussion and Q&A as possible. As usual, we've selected the top questions that have been coming our way over the last several weeks. As usual, we are so grateful to you for those questions. Keep them coming our way so that we can continue to respond to what you know and what you've learned and work together to improve our response. William and Mary is in the thick of planning for the spring. We are building on what we've learned from the fall. We are going to be flexing the new muscles we've grown together for adapting teaching and social life and working life and research. So we have a lot to talk about today. This is going to be a two-part conversation. Part one focuses on how William and Mary is approaching the rest of the 2021 academic year. Part two is focused on how we make decisions about public health, how we use the latest science and the data that we're gathering in real time, and how that will impact our spring planning. So for part one, we're joined by my close colleagues, university leaders who are familiar to many who have tuned in to our community conversations and our town halls over the last 8 months. Our provost, Peggy Agoris, our vice president for student affairs, Ginger Ambler, and our Chief Operating Officer, Amy Sebring. Welcome. We're going to be answering questions together from the community, and as always, we'll move as quickly as we can to move through as many questions as possible. I'm going to start us off with really big picture of lessons learned. Peggy, then Ginger, then Amy. What would you each say is the greatest challenge that we faced in the fall, and where have we found the greatest opportunities?
Well, I think that, first of all, I want to take this opportunity and thank everybody in our community and the surrounding communities for helping us be where we are today. We started off during a time that there was a lot of uncertainty. If you remember in August, late July and August, we had a lot of uncertainty regarding the occurrence of the pandemic and the rate of disease that we were observing. So I would say one of the biggest challenges was the uncertainty of what lies ahead. And when you plan for an academic semester with all the things that are related to it, from the fact that we were expecting new community members with our freshman class, new parents, an environment where we usually anticipate a lot of interaction, learning from each other and being happy to be around, we had to really think of a semester that would be a little different, and actually how different we did not know at the time. So I would say a big challenge was the uncertainty and the inherent risk taking that it included, not knowing for sure how we're going to be doing things and how well the things that we were planning to do would work.
And maybe the quick big opportunity.
Oh, well, the biggest opportunity is to do things differently, to really learn to be flexible and pivot very quickly, and to understand that we can do things that we don't usually do. So overall, to take a chance on each other and on our capabilities, and really become better at what we do.
Thanks, Ginger. I cut you off.
No, that's quite all right. I would just build on what Peggy said, and that is, never before have we had to design a living and learning experience around such uncommon public health guidelines, and trying to envision what it would be like for people to live, learn, work, study, do research with masks, with 6 feet of social distance. That was a challenge. And it's been wonderful actually to watch how student life, how faculty and staff life has continued to go on, even with those unusual restrictions. I think the opportunities for us are enormous. The most important lesson learned for me, though, is that it took the entire community. We would not be here today where we are if everyone in the William & Mary family had not done their part. And I'm especially proud of our students who have been so faithful with our Healthy Together commitment.
I talked very early on in one of these community conversations about the challenge we faced of creating shared norms where none existed in the country. We didn't arrive. None of us arrived here in August and September with a sense of what the shared norms were. We had to shape them, and then we had to turn them into habits, not just rules, but habits for the community. And we've done that steadily and with so much dedication. Amy, why don't you jump in?
Yeah, so, reflecting back on where we were in the fall, we had so many questions before us. I mean, really, it was in the summer as we were planning for the fall. And, I think trying to go through those questions and arrive at how we were going to start the semester and frame the semester, we often found ourselves kind of going to a common denominator, right? We were trying to answer so many questions and to try to get it right for as much of the community as we could. I think, as we continued on into the semester, what we realized is that people were really experiencing this semester differently. And one of the challenges I think we faced was figuring out how do we bring in different voices, and how do we help make sure that as we were refining our decisions, that we were getting input from graduate students, undergraduates, different employee groups, folks that are working parents and having to juggle the realities at home, those of us that are caregivers and having to think about all of those things. And so, over the course of the semester, for me, one of the biggest challenges was not only answering the big questions, but then also recognizing where we needed to provide for members of our community who were really experiencing, very different, complicated aspects of operating under a pandemic. Thinking about opportunities, what I would say for me, I reflect back often on a conversation that Dr. Ambler and I had probably in July. And I think I realized we weren't going to be successful in doing all of the things that we needed to be doing for our students without really supplementing the expertise in Ginger's group. Not because there wasn't really great expertise there, but just because we were trying to accomplish so much in really new territories. And so our ability to bring expertise from across the campus in a number of domains to help us problem solve and provide the resources that our students, faculty, and staff needed, I think has really been one of our biggest opportunities.
So you used the word refine, which kicks us into the next question I wanted to ask all three of you. And Amy, maybe I'll start with you. Can you say a little bit more about what we've learned from the fall that will guide us in the spring, how we've refined, how we've adjusted?
Yeah, so I think, it's interesting. I mean, one of the lessons learned for me is that it really is important to stay the course, and that, Unfortunately, much of the public health situation is not substantially different and potentially could be worse as we enter the spring semester as to where we were in the fall, as we enter the fall semester. And so one, I think important distinction is making sure that we are really circling back to the core principles. I mean, I know you've outlined a number of times, and public health still has to be our first and foremost focus. But also recognizing that we need to deliver on our mission, and that it's really important to do that in a way that is supportive of our students, provides the faculty the resources that they need. And so for me, the refinements are continuing to get input from the community. Those of us that are making decisions, make sure we're making the most informed decisions that we can, and continuing to update those decisions based on real-time information.
Yeah, thanks, Ginger.
Yeah, I think multiple perspectives has been one of our strong suits. We have intentionally sought the perspectives of different members of our community who see and experience this place differently during this time, and taking that feedback constantly into account. And there's also enormous creativity that comes from that. We've watched so many things come to life that we didn't imagine, many things that we will probably keep as current practice going forward because it's been more efficient, or it's been more effective, or it's just, it's expanded our reach and our ability to connect with other people.
I think the connection between being efficient and wellness, well-being, is something that I'm seeing so much more vividly than I have before. And then to echo something Amy said, I think a silver lining is we are seeing all of the second shifting that is happening in everyone's life, in our colleagues' lives, with children, with parents that they're caregiving, the need for flexibility to ensure that every employee can meet multiple obligations at work, professionally, and at home and in the community. A sense of connection to this community as one of those obligations. That's something that's really grown in awareness on this campus, I think, over the fall. Yeah. Peggy, jump in and give us a sense of what lessons learned from the fall are guiding the spring.
Well, just as we learned from spring that we needed to be more thorough and prepare better. We didn't have a choice then, but we had a choice in the fall. We learned more things. We learned about the pace, that we needed to really implement a slower pace. Not that the faster pace was intentional. It was a way to protect us from something that we did not know how it would evolve, namely the pandemic. So creating a more appropriate pace for spring is what we did. We worked together with many groups around the university, first and foremost, the schools and the deans and the faculty, to understand what the issues were in the fall. We focused on wellness. Overall, it is very important that we embed in our semester days and opportunities for other connections to be formed, which are outside the classroom, and to have programs in place that will enable our students to both feel that they are taken care of by the institution, but also have the freedom to relax. And this is another lesson learned, which was very important. That's why we embedded not just 5, but 6 days of respite in the spring curriculum. We start and end at the time that we said that we will. So the semester is not a compressed semester. So we learned that flexibility, working together, just like Ginger and Amy said, understanding the modifications that we need to make in order to be better, and believing that we can do this together has been some very useful lessons that we're implementing in the spring semester.
So I'll just underscore, coming out of last spring, one of our design principles as we put in the months of planning with a large and extended teams that we each had working on different dimensions of campus life, curriculum, operations. One of the principles was design for those who are most vulnerable. We led that with curriculum. What were the obstacles that students experienced in remote learning in the spring? How would we address those? By providing multiple scenarios for learning so students can choose what's best for them, whether they're first gen or in communities that are really vulnerable. to the pandemic, African American communities, Hispanic communities. We have extended that, I think, in really important, deliberate ways in our testing. Again, design the testing program for those who are most vulnerable. Think about the pace of the semester for moments of vulnerability that we're going to experience and that key groups experience. So I think that's something that is another silver lining as we go forward to hold on to. I'm going to switch us to our spring lightning round. So get through roughly 10 questions that are the most frequently asked questions about the spring for each of you. And the idea is to try to keep our answers to 1 minute if we can. So here we go. The first one, Ginger, is for you, which is about a phased approach to move-in. We're doing that again for the second time. Why are we doing that? And what was the decision-making process for determining who gets to move in when?
So we started with the academic program, and once it was, what we found in the fall was that we benefited both from the phasing into in-person classes, and then also phasing into residential living on campus. And so we are replicating that based on the success of the fall. So we will be bringing students back in phases, those who are living on campus. And we recognized, as we did in the fall, that we have students who need to be oriented to this place. So we have entering freshmen and transfer students who will be oriented, as well as our freshman students who were studying remotely in the fall and for whom this is their first time on campus. So bringing that group in first, along with the rest of the freshman class, and then our seniors for whom this is their last semester. We want to maximize their time on campus, followed very shortly thereafter by our sophomores and juniors. So that was the decision-making behind that, but it was all predicated on the decisions about what the academic calendar would look like, and we went from there.
So that was the top question. Who comes first and why? So thank you for that. The second very frequently asked question is about spring break. Peggy, I know that the feedback from students from the fall was something that you sought regularly via pulse surveys and more, because you and the deans are focused on ensuring that students have the best learning scenarios that they can have under these extraordinary circumstances. How are we planning the curriculum and academic schedule in a way that will allow them really to take the breaks that they've told us that they need to be able to take?
Well, as you said, we really heard the students and how they wanted to have their next semester, but also we worked very hard to ensure that we take into consideration how the impact of not having the usual type of spring break would occur. So we have the spring break days that were designed in collaboration with the deans and their offices, with student affairs, with wellness, with residence life, with our COVID response team, with numerous other staff, and of course with the resilient curriculum squad that you, Madam President, have put together to ensure that we have a sprinkling of not 5 but 6 days throughout the semester. And these days were chosen in a way that it gives the opportunities for various ways of taking respite. For instance, one of these days or a couple of these days are aligned with the school breaks, so that faculty can really design those days when their families have time off. Others are longer weekends, so that students have an opportunity to do more. We also have, I personally asked the faculty to ensure that these are true respite days, and that they design the work that they assign in a way that it does not due the day after, and that these days are truly days for the students and the faculty to really ensure that they take the time that they need.
I'm so grateful for that, and listening to the planning process has gotten my creative juices flowing. I imagine that's true for others in our community. Supposing you were somebody, let's say you were the president, and you had an idea for a new tradition to invent for fun on one of those days, how would you suggest that idea to those who are planning?
Me?
Would we write to provost@w@m.edu with our suggestions?
Yeah, absolutely. So I have a lot of opportunities to interact with the students and the student assembly, and I would love to hear that. I would love to hear that.
That's great. So then copy you and student assembly with our ideas. some ideas coming your way. Let me shift to mental health and wellness. Ginger, I'm going to go back to you because your team has worked to develop new resources and opportunities from the summer on through the fall to support mental health in our community and resiliency, well-being. When I talk about well-being, I think about organizational as well as individual changes. I know you do too. For us faculty and staff as well as for students. So could you give us just a quick overview of those resources? And is there anything else that we're doing to ensure the well-being of everyone in this community in the spring?
Sure. It's been exciting to see the creative juices, as you said, flowing around health and wellness in particular. But our virtual wellness website, which launched toward the end of the summer, has been accessed over 22,000 times for workshops, for classes, for all kinds of virtual connection. We launched our Ways to Flourish podcast, which is available on Spotify and through Apple Podcasts. And we've already had over 2,000 downloads, and that's been less than a month since that was launched. Our Healthy Together training and education has really spotlighted the public health approach that we've taken, that it's a community-wide effort and that our collective well-being really depends on our all being in this together. And so that's been really critical ongoing throughout the semester. And also robust telehealth and teletherapy options, which has expanded our reach for students who are studying remotely or for those who may be immunocompromised and can't be on campus for some of those services. I will add that we're exploring a new app for spring that's a research-based tool that empowers students to build authentic social connections and addresses the mental health impacts of loneliness. We know that during the pandemic, not just on college campuses, but everywhere, people are feeling disconnected and in some places isolated from others. And so we're really paying attention to what science has to tell us about how to encourage strong social connection. That's really important for us.
So Amy, this question's for you. The next most frequent set of questions from faculty and staff have to do with telework, how that's going to go forward, and travel. Because travel, I think, means different things to different people. Could you talk about the message that you sent earlier this week about William & Mary's telework and travel policies and what staff and faculty can expect?
Sure. So we did a lot of work coming into the fall. Each of the cabinet members developed work plans with their faculty and staff to identify employees who were able to continue working remotely. And those that the work required them to be in person, either some of the time or all of the time here on campus. And so we developed those originally with an eye just to get us through the end of the calendar year. But again, given where we are, we recognize that much of at least the early part of the spring is going to look a lot like the fall. So the message I sent earlier this week was to let the campus community know that they should continue working with their cabinet members. If the work allows for folks to be working remotely, we want to continue that and encourage that. For folks that are able to work from home, that not only reduces their exposure to the virus, but keeps less potential spread on campus for those that need to be here working on campus. And so cabinet members have been asked to go back, review those plans, but to continue them to the extent possible and to make modifications. Again, if there are things that we realized didn't work quite as we had thought in the original plan for the fall, be able to go back and make that shift. So continuing to review and revamp as we are able, but much of the work will look, I think, similar in the spring as to how we've navigated successfully this fall.
Thanks. Right, I'm going to shift to it.
You want me to talk about travel for a minute?
Oh, yes, I do. Sorry. Yep, please do.
Yeah, travel is a really complicated one because we do all sorts of different travel on campus. We continue to be cautious, right? I mean, the world as a whole right now is much more limited in terms of its travel. And so, again, the public health requirements are where we're focused, but we also recognize for faculty in particular, that there are certain aspects of their scholarship and their research that may require them to be in person. And so we've asked each of the deans to work with the faculty if there really aren't alternatives, if there's not an option to do something remotely, if it's not an activity that can be deferred. In limited cases, we recognize that there may be instances where If you're out on an archaeological dig, or if you're a VEMS faculty member and need to be out on the Chesapeake Bay, hard to do those things remotely. And so have asked the faculty to work with their deans to identify if they absolutely need to be traveling to make those plans. For staff, more restrictive on staff. There are very few things that staff do that absolutely have to be done in person. From professional developments and other things. I mean, a lot of the world has moved to virtual opportunities, and so we're encouraging staff to take advantage of those opportunities. But in some cases, recognize that there may be day travel during the day, not overnight travel, where if there's a work-related reason where it needs to be in purpose, we are allowing for that, again, in some limited instances. In both cases, for faculty and staff, if folks are going to be traveling, we have set the expectation that they quarantine for 5 days when they return. So to work remotely for 5 days before coming back to campus, to give time for them to develop symptoms if they have in fact been exposed to the virus. So mostly still trying to be very, very cautious on travel, but also really focused on mission. And if the mission needs us to be in person, figuring out the ways that we can do that most effectively with the least level of risk.
Thanks. All right, folks, I'm watching the time, so I'm just going to ask us to move quickly over. We have about a handful more questions, and they focus on curriculum and campus life. So Peggy, very quickly, what is going to be the pass-fail policy in the spring?
Well, as of now, and based on what we know and what we're planning to do, we do not anticipate any changes in our pass-fail policy. There is nothing that indicates that we will do things, that we should do things differently. We have a regular semester in terms of duration. We have respite days that are spread throughout. So our pass-fail approach will remain the regular one.
Okay. Ginger, you talked about a new app. What other things in campus life are going to help students who are remote or here connect with each other in the ways that matter so much for their success, as human beings, as learners?
We're going to continue to try to support students in building community in the places where they gather, even if they're gathering in smaller numbers, whether that's in residence halls, in online classes. I will say that, we've done some experimental things this semester, from s'mores in the sunken garden to pumpkin carving events and much more outdoor activity. We've had over 400 of our 475 clubs and orgs have been active this semester, and we've actually added 11. So that tells me students are finding one another around common interests, and we want to support that in as many ways as we can. And also to pay attention to the traditions that are important to William and Mary. For example, ODK and Mortarboard, which are the two student organizations that sponsor Yule Log, have been enormously creative in creating a virtual experience that our whole William and Mary community will be able to enjoy in December. So continuing to just ignite creativity where we can and support students in finding each other.
I have been blown away by the creativity and resourcefulness of our student leadership, both student assembly and leadership in so many different student organizations. Much of what has been successful this fall, from the s'mores on, has come from their creativity. So Amy, thinking about all the different ways that we've used campus, I am imagining it's going to be colder in the spring. We know that, and we're thinking about alternative locations to gather. How are we thinking about that?
Right. So certainly doing some thinking around, recognizing that the beautiful weather we had in September may not be the weather that we have in January and February. So, we continue to obviously monitor the governor's guidelines, the state guidelines, CDC, and others. I will say, and this community knows, there have been instances where we've actually opted to be more restrictive than those guidelines if we felt that it was warranted for our community. But we certainly will make sure that we are at least in compliance with anything that is coming out at the state level or the federal level. And then importantly for us, we continue to look at ways to adapt our spaces. I'm working with colleagues right now in our public safety and facilities management groups to see if there are modifications we can make in the dining halls, recognizing that, people are going to need to eat, and it's going to be likely, at least in January and February, that grabbing a bite and sitting outside may not be quite as easy. So looking to see if we can make enhancements there that will be more conducive to folks eating inside. I'm continuing to look and working with the registrar's office on any unused spaces that we may be able to establish for students to gather more informally indoors in ways that are safe. So really trying to look at what all of our options are, utilize every corner of the campus appropriately. And I would just say, I'm really open if students have ideas. So please send me ideas. If you have a need and say, I just need a place where we can do X, coo@wm.edu would welcome those ideas. I can't promise we'll deliver, but we know how important it is for you to be able to come together in certain ways and want to be able to support that to the extent we're able.
Well, I think I'll just close by underscoring that one of our superpowers this summer and fall has been input from the community, steady, respectful in general, in great ways, creative input. And we need your questions. We do need your ideas. We can't accommodate them all, but all of them have helped us figure out how to come together safely or study and work remotely in a way that's successful. So do keep those questions coming. I know there are a lot more questions. How many people can gather together in the spring? How will we use space? I want to just underscore that William & Mary is very focused on following the science and data from our local and our national public health sources, and from the ones that we gather here. We will be complying with guidelines from the governor and the CDC, or going beyond, as you've heard from all of our speakers today. In some cases, we will be making changes, as we had to in preparation for the fall, because we know that the spring will be different. So you can count on us doing our best to keep you apprised as those changes are coming down the pike, letting you know periodically how we're thinking about the semester ahead and responding to the questions that come our way. It's hard to tolerate uncertainty, but making decisions in a phased way, as we have been based on current data, has been a key to our success so far. So we thank you for your patience so much. I'm going to wrap us up and thank our participants for joining us, all three of you, and for everything that you and those you work with have done to make William & Mary successful this fall. And to those watching from across the ether, we're going to turn now to the second part of our conversation on the science and the data that William & Mary uses in COVID-19 decision-making and how that's setting us up for the spring. Thank you. Stay well, everybody. Good afternoon, William & Mary. For those of us just tuning in, we're launching the second half of a two-part community conversation this afternoon. This discussion is going to explore the science and the data that we've used to safeguard health and how we're planning for spring 2021. We're joined by members of William & Mary's Public Health Advisory Team. This is a team that's comprised of medical professionals and public health experts from across the university. They've advised university leadership and the COVID-19 response team throughout the fall, guiding policy and ensuring that we make informed decisions that keep our community safe. Joining us are Dr. David Dafashi, Medical Director and Staff Physician in the Student Health Center, Professor Carrie Dolan, an epidemiologist and member of William & Mary's Health Sciences faculty, Professor Iyabo Obasanjo, a public health expert on William & Mary's Health Sciences faculty, Chief Technology Officer Corinne Piketaghi, and Dr. Virginia Wells, Chief Medical Officer for Athletics and Infectious Disease Expert. Thank you all for joining. So the key goal of this conversation is to talk about how we're safeguarding public health. That is the #1 priority of the university. And within that priority, how we can continue to come together safely to work, to live, and to learn, and how we can safeguard the health of our broader community, families, our localities. One of the things that's important for the William & Mary community to understand is that we are engaging at all levels of the university in a comprehensive public health response based on science and data. We have been since the summer. We make no decisions that are not based on the science as we understand it now and the data that we're gathering. So I want to ask Dr. Dolan if you would start off by describing how the Public Health Advisory Team works on the ground.
Sure, thank you. So the Public Health Advisory Team on the ground looks like a group of people who are actively engaging in both local level data and peer-reviewed publications. And so in practice, what it looks like is we receive questions or somebody flags an area of particular interest, and then we go to the science. So we look at our peer-reviewed publications, and then we also are actively looking at local level William & Mary data in order to triangulate all of our resources together and then be able to give information to the administration so they can formulate a policy response. It's a very efficient team, and it's been a lot of fun to work with this team because it's a team of people who are really dedicated to trying to get the best possible information that we can get in order to formulate our policy decisions on campus.
Thanks. One of the things that's been striking to me is how fast the science is changing. So we're in a space where there's some very, very established techniques. Let's say PCR testing has been around for a really long time, but we're dealing with a new virus. It mutates. We're dealing with real-time data about how it acts in communities. Can you talk a little bit about how you work fast in that kind of an environment? And then I'm going to open it up more broadly and ask both Doctors Dafishy and Wells to jump in on lessons learned. But Carrie, can you give us a sense of the speed at which you're working?
Yeah, so what it looks like is that somebody from the administration or internally, anybody, can flag a particular area of concern, and then we're able to directly access our data. So Iabo and I are able to pull in the local level data and analyze that pretty quickly in Stata and try and look to see if we see any patterns or any areas of concern. And then we meet with Dr. Wells and Dr. Dafishy, along with our other administration that's involved, Corinne and Amy Sebring, in order to think about how that data impacts what's currently going on campus. We meet every week, but we talk daily, both in our Teams app and then also through email. So it's a very communicative group that works really well together and is very collaborative in sharing both information and resources in order to move forward on campus.
One of the things that's been incredibly powerful is your openness to explore any question that comes your way. So thank you all for that. Let me ask some big picture questions of all of you now, all five of you, starting with Dr. Dafishy and Dr. Wells. What do you think have been the most important factors in our success so far this year?
Well, thank you, President Rowe and Dr. Dolan, for that wonderful introduction. But I would just say very briefly that, I think the COVID pandemic is a perfect example of the old adage, an ounce of prevention is worth a pound of cure. And certainly one of the factors has been William & Mary's incredibly, positive response to the Healthy Together initiative. And, what we refer to sometimes as adherence to that healthy triad of behaviors, physical distancing, scrupulous hand washing, and of course, appropriate mask wearing, all the things that sound easy, but aren't always as easy as they seem. I think that the community here at William & Mary has done such an outstanding job of following those guidelines. And for that reason, we have been fortunate to have very few cases. I also think we've been fortunate to have the resources and the availability of testing measures. We've been able to do some universal student testing on a number of occasions throughout the semester. And then, of course, well-guided prevalence testing that's really helped us to manage the numbers as well.
And I'd echo that. And we've, been very aggressive with our testing among our student athletes, which has improved our outcomes with our athletic participation and emphasizing our use of mask wearing. And we're happy and pleased that the CDC has caught up with us and that masks protect us, the individuals wearing the mask, as well as protecting others. So this has been a very, very important factor in reducing the spread of COVID.
Professor Obasanjo and then Professor Dolan, could you talk about what we've learned in the fall that's going to influence our decision-making in the spring, given the pace at which we're learning? Both of you are epidemiologists by training and now by practice and trade in real time. So What's been helpful that we're going to carry forward?
I think one of the most important thing that came up was right in the middle of the semester, we had the ability to do sewage testing. And we were not sure how useful this will be, given that we were doing prevalence testing and we were also doing total population testing in between that. But Corina and I decided that this was something we were going to dig in without a lot of information from other universities on how they were using the sewage testing. And it has been a revelation. Combining it with the prevalence testing has allowed us to target dorms for whole population testing. It's just allowed us, it just opened up a whole lot of avenues that we didn't even realize we could use it for. And it has been very helpful. And sometimes the data comes in the middle of the night, and Corinne, bless her heart, she's there digging it up and kind of sending a team's notice at the last minute. How should we use this to make a decision about prevalence testing? So it guided us and helped us do targeted population testing. So that was a lessons learned that hopefully will carry on in the spring.
And I'll add, it was part of how we caught those false positives. Is that right, Corinne?
That is right, yes. Without having that expectedness of the results from wastewater and prevalence testing, it would have been, it may have been missed, or definitely wouldn't have been as easy to recognize that as an anomaly in what we had seen previously.
Corinne, could you talk a little bit about that? That was a surprise. Were there other big surprises in managing the virus on campus more broadly?
Ooh, I think one of the biggest surprises to me, and something that we prepared for early on, was just how we were going to encourage the community, the campus community, to be so responsive and cooperative, recognizing that participating in testing, following the case management protocols, that those were requirements for us to be successful. And I was surprised and so pleased that everybody did their part, faculty, staff, students. It took everyone, and everyone participated as they should. And I think it made an incredible difference in our success.
Could you estimate how many human beings, all told, at William & Mary were involved in running the testing, quarantine, and isolation operation?
Ooh, 200, 150 at least, yeah.
That's incredibly impressive and so coordinated, so planned, so well implemented, with so much compassion and care and constant refinement to catch where were the bottlenecks and adjust them. I feel incredible pride in our colleagues, and seeing colleagues from across the university, from advancement, events planning, IT, student affairs, our physicians, our faculty, epidemiologists coming together in that work, our communications folks, so that we could keep the messages really clear and really swift, as fast as we could, to get the information to folks who needed it. It's been a revelation in what we can achieve together. And I've seen so many relationships forged professionally that I think will last for a really, really long time.
I agree.
For Dr. Dafshy, maybe the last big picture question for you: what do we know about COVID today that we didn't know back in the summer?
Gosh, well, as was just previously stated, we now know that masks protect not only the wearer, but also those around us, and the wearer as well, rather. I think we have a clearer idea of the mode of transmission, the infectivity window, the period during which a person is still infectious. And I think we have a clearer understanding of the importance of testing individuals, prevalence testing, surveillance testing, as we now know that the very significant percentage, particularly of the younger healthy population, may not have symptoms, or very minimal symptoms if they do. So I think we have a better understanding of the importance that asymptomatic surveillance testing plays as well. With that said, we also know at 7 months, 8 months into this now, that pandemic fatigue is a real entity. It's something that does exist. And it's a potential threat as we head into the holiday season. in terms of effectively, combating the disease. But I would also say, at least on a William & Mary level, I would say that it's just been nothing short of phenomenal. I think how individuals on campus, students, faculty, and staff have made these sacrifices look so easy, and they're not easy, and people have just been following the guidelines incredibly closely. And I just think it's just an absolute testament to what can be done when we put our minds to something. So, that's kind of where we are with that.
One of the things that was very different about the approach we took was our emphasis on how do we uncover invisible contagions. So we have a largely asymptomatic population, and testing of asymptomatic students was just an incredibly important part. Find out who is infected, give them a chance to get well without infecting other people. I will credit our students. The polling that we did this summer that said overwhelmingly they wanted to be here, overwhelmingly their number one worry was that they would get somebody else sick. And so this was how we followed through on the seriousness of that concern, how important it was. And we're doing it all the way through the semester. So students and employees can sign up at will for free testing at the right timing before they go home. And I think we have something like 4,000 tests queued up now over the next several weeks.
It's important to also add that the vast majority of this relatively small number of cases that we had were detected not through symptomatic testing, but through asymptomatic testing.
Very, very few people felt ill. And that was true right from the beginning, from our pre-arrival testing. So I'm going to go into our lightning round. We have a lot of questions. These are the questions that have come in over the last several weeks. So we've prioritized the ones that are most frequent. I'm going to ask you all to try to stay to 1-minute answers because there's roughly 15 of them. And I'm going to try to be brief too in this lightning round. Most of these questions are focused on the spring. Dr. Wells, can you start us off? What scientific data are we looking at to determine the path we want to take in safeguarding the health of the community going forward?
What we're going to look at, we'll follow the biodirectional models that's out there to guide us, look at disease prevalence, hospitalizations. We're going to look at what's changing in terms of virus transmission, what's new, what we know about it, vaccine data. All of this will help us to guide our processes in the spring.
Dr. Dolan, we talked about your concept of know your number in a previous conversation, kicked that off in the spring. You helped to develop that concept that the university has been using. So I'd like to ask you how relevant you think it's going to be in the cold winter months early in the year.
So definitely that know your number is a tool to help us learn how to coexist and to communicate where we are on this spectrum of 1 to 5, with 1 being more conservative and 5 being more open in terms of how we interact with other people. I want people to know that follow through is really important, even when that is difficult. And we could have really taken an easier path as a committee, as a university community, but we took a path that was based on solid data and science and commitment to that path, and then follow through. It has really been impactful. And so that know your number thing is a tool to be able to continue on and discuss with families where you are on the spectrum and how that relates to the path that we have here at William & Mary.
Thanks. I have a set of questions about testing. Corinne, I'm going to direct them first to you. Will William & Mary be requiring as much testing as it did this fall?
I think it's safe to say we're going to have a very robust testing program this spring. The landscape changes so much that the approach might alter a little bit, as well as the tests in our toolbox as that changes in the industry. But I think our students should expect, and faculty and staff, everyone should expect testing in the spring.
And can you say just a few more words about how exit testing is working? And is it something that's available to all students, all employees?
Absolutely. So we made sure of that. Yes, it was an opt-in, not required, but about, like you said, 4,000 members of the community opted in for a test. They were able to say what day they were departing campus, so we could strategically schedule them to receive their test as close to that date. So those results were very relevant to their travel plans. same approach that we've used throughout the semester for prevalence. A PCR test results in 24 to 48 hours from the time the lab receives them, and it's going great.
That's fantastic. We've received questions about the lab and about Calico, our logistics company. Are we planning to use them in the spring?
Right. Calico is the technology and logistics partner we've used this semester. Fortunately, one of the reasons we partnered with them early was their extensive lab network. And we plan to leverage their shipping and IT logistics in the spring as well to take advantage of that expanded lab network.
It's been a series of questions about quarantine. I'll start with Dr. Dafishy. How successful were the quarantine measures we had in place in the fall? Will we be doing anything differently from the team's perspective?
So in answer to the first part of the question, in a word, extremely. I think it went very, very well. Again, we had a fairly low incidence of COVID due to a number of reasons that we've already discussed. But I think positive cases were very, very rapidly identified by a medical provider. And close contacts and contact tracing was done in a very swift and timely way. Individuals were relocated to Richmond Hall if they lived on campus. If they lived off campus, other arrangements were made either to isolate or quarantine in the location where they were or to go home. So I really do think the timeliness and the thoroughness with which close contact tracing was done and the rapidity with which isolation was identified really played a significant role, certainly in the containment and mitigation of the disease. Again, we are continuing to collaborate with VDH in terms of making certain that we are identifying close contacts. We will continue to do that in the spring. And another component that I think is important is, the case management program has done such an excellent job of making sure that individuals who are isolated or quarantined, receive the necessary resources and remain connected and engaged in an academic way. And we'll certainly try to build on that to make certain that for those individuals that they continue to remain plugged in and engaged in a way that allows them to be a part of campus, even if they are physically distanced.
So there's a host of questions that came in about the regional and national picture, which is very, very sobering right now. It was also in August regionally. In August, this region was a hotspot in Virginia, and we saw positivity rates nearing 10%. We've been incredibly fortunate with the dedication of our surrounding community as well as the campus to be driving those positivity rates down, but across the country and also in Virginia, we're headed back into another surge. So Dr. Wells, could you talk about, as we watch these national numbers continue to rise to record levels, what do we know about Virginia and our region that we should keep in mind?
Well, unfortunately, the cases are increasing in our state. I think all total, we've had over 200,000 cases in Virginia, and I think nearing 4,000 deaths in Virginia and over 13,000 hospitalizations. So, we're approaching now, I think 7.5% or so is the number where we are in the last past 7 days. So the numbers are increasing, and we do, Northern Virginia being, sort of the hottest spot in our region. So we're definitely seeing a big spike, and our hospitalizations are going up. So we are definitely trending with the rest of the country. And in the past 7 days, I think our cases are up about 2,000 in the past 7 days. So we definitely do have to be mindful of that. Our general region, James City County, Williamsburg area, we're doing fairly well, but north of us is a fairly hot spot. So we do have to be concerned about that.
And around us, the states around us too.
Yes.
So I want to take a moment to credit Provost Agoris, some of the deans, and something like 20 faculty members from different schools who helped plan this fall calendar. It's been tough to be accelerated this fall, but we had concerns about a late fall winter surge. They have proved valid, and the fact that students are able to go home now in advance of what may be the worst of this surge is a great relief, I think, certainly to us and to many families. Dr. Obasanjo, could you talk about how William & Mary works with local and state public health officials to help control the spread of COVID-19? Because contributing to that effort regionally and nationally is one of our dominant goals. And I know this is your expertise.
Okay, thank you. We have to work in the Department of Health by law. Every positive case has to be reported back to the state authority, which in our case is the VDH. So Dr. Wells and Dr. Dafashi are in communication with the epidemiologists at VDH constantly, reporting cases. And every time we get a positive case, they have to be notified because COVID-19 is a notifiable disease, both at the state and federal level. After they are notified, we do our own case management, and has been described already, we have a very robust case management and follow-up process that is internal to William & Mary. VDH also has the authority to do their own case management because that is by regulation their job for a notifiable disease. So they follow up after what we've done, and they can increase they can change things, and we have to abide by them. We have a very good working relationship with them at this point, which has built up over the fall, which we hope to continue into the spring and continue to work together and kind of just follow up with them. So we do have to work together by regulation, and we do.
Really grateful to have that partnership and for the effort that's gone into making it as smooth as possible. A number of members of our community, faculty and staff and families have asked if our nation goes into lockdown in the winter, how will this impact William & Mary? And so I thought I would respond to that one since that decision ultimately rolls up to me. The first thing to know is that we are prepared to adjust as we did in the fall, as we were in the fall. I'll remind everybody that because of the spike in August, we did make adjustments in the fall, and we'll be using the same process in January, continuing to apprise our community of what the context is and how we plan to make decisions. As Dr. Obasanjo said, our resources include the Virginia Department of Health, national public health guidelines. We share expertise and experiences among other higher ed institutions in Virginia. The Council of Presidents meets weekly, and campus medical officials, COVID-19 response leads as well. So there's a strong network of expertise in addition to our expertise here on campus that we draw on. I'm going to shift to another set of questions, looking forward more, questions about the vaccine, about case management. And I'm watching the time, so we're going to try to speed up just a little bit since there's a number of questions left. Dr. Wells, quick question to you about COVID-19 vaccines. Do we think that the vaccines that have been described in the press will change the spring semester planning?
I think it's too early to make a decision. Since we don't speculate or project, we'll wait until we have some very good high quality information to make an informed decision. And we're just not there yet on that vaccine.
Dr. Dafashi, can you say what case management in the spring is going to look like from a student's perspective? When a student tests positive, what happens next?
Well, Dr. Obasanjo did such a superb job of describing some of that a moment ago, but effectively, we have a pretty well-oiled machine now in terms of case management and a growing number of case managers that's made this whole process more seamless and more efficient. But effectively, what happens is when an individual is identified as having a positive test or perhaps being a close contact with somebody who's had a positive test, they initially have a conversation with a medical person. One of the physicians will reach out to them, explain the terms of the isolation and what they should expect, ask about their well-being if they're having any symptoms. After that, as Dr. Obasanjo mentioned, we're obligated to let the VDH know so that they can collaborate with us and continue with more extensive contact tracing. But what we then do is make certain that this individual has reported COVID to the Report COVID website. So they go online, they answer a brief questionnaire, and what that report does is it generates a case and a case manager. So that individual will be assigned a case manager, and that case manager is effectively their point of contact, their guide effectively through that 10 to 14-day period, whether it's isolation or quarantine, so that they have what they need to be successful as a student. On-campus individuals are identified and they are relocated to Richmond Hall, which is our quarantine and isolation dorm. Off-campus individuals will either isolate or quarantine in place. All individuals have the opportunity to go home if that's their preference. But really, we're going to continue the collaboration with the BDH. We're going to make sure that William and Mary has its own robust methods of rapid identification of cases and close contacts, and again, just kind of work on making certain that the experience over in Richmond Hall or wherever they happen to be quarantining or isolating is as good an experience as it can possibly be. And I think the case managers are just doing a tremendous job of making sure that that is indeed the case.
My memory is that someone's waking up at 3 a.m. to look at the test results so we know if there's a positive, and that gets into the case management system. Just want to stress that again. Am I right, Corinne?
You're correct.
and that care, that understanding of how bad it feels to see a positive result is so important for our community. We've been fortunate. There haven't been very many positive results in the grand scheme of things, but each one matters. Each one is a drop in the stomach when you have it. And we all, I think, now know somebody who has had COVID, and many of us know people who have passed away as a result. So taking it as seriously as we do is a great source of comfort, I think, for this community. Thank you. Thank you all. So I'm gonna ask for final words. I would love to ask each of you for just one piece of advice that you give to our community as they head into the Thanksgiving holiday. And Carrie, I'll start with you.
Sure. So it's important that we find ways to interact with people that we love. And we have been practicing that all fall at William & Mary, and we have been successful. So take some of these lessons we've learned from these creative ways that student activities have engaged over 400 different organizations this semester, and go home and enjoy your families with your masks 6 feet away while washing your hands. And we look forward to seeing people enjoy their families and enjoy the holiday season in a way that's safe.
I would just echo that, really, and say, don't let up. It's been a long time. It's been a long haul. You guys have done a great job, but we can't let pandemic fatigue get the better of us. We want to continue all the measures that you guys have been so successfully enacting. At the same time, I think it's so important not to wait for the rainstorm to end, but to learn how to dance in the rain safely. So again, I hope this holiday season you'll be able to enjoy many of the things that you've always enjoyed, albeit in a slightly different and more protected way.
Yeah, I think that's an important message. And I think that I try to message that to our student athletes on a regular basis, is that we can still engage with one another, and we just do so safely. And I think that it's important to remember that we're trying to protect each other and care for each other. And I think if we approach it in that sense, and knowing that, we are really just trying to care for each other and engage safely, but still engage, and remember that we're in this for a long haul. It's going to be probably another 4 to 6 months of this. And whether we have a vaccine or not, we still have to continue to mask and distance, but stay engaged. And I think that's the same message everybody's giving.
I think the thing I would add to that, certainly support everything that's said, is recognizing the spring semester will bring these new modalities of teaching, learning, and working is just take a screen break, detach, unplug. We've been so connected digitally for the last few months that I think going into the end of the year and looking ahead to next year, just close the laptop, put the screen aside, and just be away. That's my advice.
Great advice. Yaba, will you close us out?
Yes, and I'm going to take a different route. I agree with everything that has been said entirely, but I also want to talk about opportunities to engage in a different way, because this team has just been a wonderful group to work with, and that you never know when the opportunity comes for you to meet new people, meet new colleagues, associate with them, and I hope for everybody else on the team, it has been a very fulfilling experience working with these colleagues over this semester. So I'm hoping that we continue with it, and that everybody else kind of, if you're invited to something, join. You never know where it will lead you and what good it will bring to your community, to the world, or just meeting new people and meeting good professionals that you can work with.
Well, I'll second that and say how grateful I am, and on behalf of all of William and Mary, how grateful we are for the incredible counsel that you've given us, the insight, the research, the translation of science into practice with real impact on a daily basis. Your counsel and your expertise has been complementary in the best sense. Different perspectives, different knowledge base, different methodologies coming together for the benefit of the university, and we're so grateful. I want to thank you for joining us, all 5 of you, and thank everyone who has watched our conversations this fall for joining. We are continuing to navigate new territory under pandemic, and as you can hear, we are using the data and using the science to get better at that as we go. Your input, your questions helps us do that work. Our next conversation will be in January. Until then, I wish everybody a happy Thanksgiving and a very safe winter break and much respite. Stay well, William and Mary.